It's a pleasure to introduce our next speaker. I'd like to introduce Janice Zook, who is a physical therapist. I think the timing of this is perfect because our last speaker spoke about body and the bones and how acromegaly affects all of the above. Janice Zook graduated from physical therapy education and the University of Utah. She's been practicing physical therapy for over 30 years. She is a board certified in orthopedics. She has worked in the outpatient physical therapy department at St. Joseph's Hospital and Medical Center for 23 years. Raise your hands. Who's ever worked with a physical therapist? I want Janice to look around to see who your audience is. You've got a lot of people that know what you do and those that she's going to educate. If you've not utilized the expertise of a physical therapist, they're quite special. Janice, thank you.
Okay, so the topic of my talk is improving quality of life with physical therapy. So before I start, I'd like to do a little plug for our state. The Grand Canyon, I don't know if you know this, it's one of the 7 natural wonders of the world. It's my favorite place in the world, and I feel very lucky to be close because I try to get up there often. If you get the chance, I would highly recommend a visit if you have some extra minutes on your visit here. Okay, so our course objectives will be defining physical therapy and discover how physical therapy interventions can improve symptoms in acromegaly, review the basic disease process in osteoarthritis and its impact on the bones and joints, and discuss the benefits of physical activity and exercise. So what is physical therapy? A lot of you know what it is, so that's a good thing. But for those that don't, it's a healthcare profession focused on promoting, maintaining, and restoring health through patient education, physical intervention, and disease prevention. Basically, physical therapists are movement specialists. So when you come in for physical therapy, we conduct an initial evaluation at your first visit. So part of that is we sit down and talk with you and obtain a thorough medical history. We ask you about past surgical history, past medical history. We discuss your pain characteristics in detail, things that aggravate your pain, things that maybe ease up your symptoms, patterns of your pain. And then we also ask you about what are your goals for physical therapy, because we definitely want to address your specific goals to help improve your quality of life. We also do a questionnaire. Usually we will have you fill out an outcome measure. And these are questionnaires designed based on body part to assess your functional impairments. And then at our hospital, we have to do a progress note every 10 visits. So at that 10th visit, we have you take that outcome measure again. And that gives us a nice little profile of how you're responding to the treatment. So then we start in on the physical therapy objective portion, and we will always do a gait assessment. Basically, that's how are you walking? Sometimes we'll test you on level surfaces, sometimes on stair surfaces. We can tell by the way that you're compensating or moving your body what areas are weak or painful. For instance, if you are shifting your trunk to the side consistently, that gives us a clue that maybe your hip might be weak, and then we can kind of hone in and specifically evaluate that body area. For me, postural assessment is very important, and it can play a role in pain provocation. And so we will do specific postural assessment and basically noting any areas that are deviating from that normal neutral alignment. We'll progress into manual muscle testing. Sometimes we just do basic muscle group testing to just see if there's differences side to side. If we find maybe there's an area that may be affected by a certain nerve, we can get more specific with our muscle testing and isolate really small muscle groups to figure out what might be going on. And then we will progress to doing active and passive range of motion testing. This gives us an idea of functional limitations, maybe where in the range you're having pain, and then that we, Sorry. Then we can focus our treatment based on these results. Further exam is when we look specifically at joints. So we might look at the interplay in your joint system. A lot of times we can look at patellar tracking. If you're having anterior knee pain, sometimes your kneecap isn't tracking appropriately and it's due to muscle imbalances. So it just gives us further information to direct our manual techniques to help achieve proper biomechanical functioning. We will look at functional movements like we're always watching you, but we will see how you're transferring from sit to stand. If you're compensating, if you're having to use your arms a lot, we can look at how you're getting up from the floor, if you can indeed get to the floor. We will also look maybe how you're reaching up into a high cupboard height to assess impingement issues in the shoulder and things like that. Fall risk assessment is important, and so we will test our balance, your balance during the objective portion of the exam. And there are certain things that can increase your risk for falls. One of those is a history of a fall within the past year. Also, if you have lower body dynamic weakness, or if if you're taking multiple medications, especially if you are taking maybe a sedative, that can increase your risk for a fall too. But following the objective exam, then we will discuss the deficits or the problem areas that we have noticed, and then we will talk with you and determine appropriate short and long-term goals, and there's a time parameter that we discuss that we want you to achieve these goals by. And then we develop a physical therapy treatment plan. So during this, we discuss frequency and duration of treatment, what kind of modalities we want to use, such as heat, ice, maybe some electrical stim, manual techniques will be included, and then we will discuss how we are approaching your activity progression too. Patient preferences are always honored. So for example, a couple weeks ago, I had a patient and he said, if you give me more than 3 home exercises, I'm not going to do them. So I don't want any more than 3 exercises. And I'm like, okay. Other times, maybe someone does not want to do any aquatic therapy. They don't like exercising in the water. So that's out as far as deciding on our treatment plan. During the physical therapy treatment, though, we do a specific emphasis on home program, because you're only becoming to therapy for a short time, and you need to be carrying over these exercises and stretches for the rest of your life, really, to maintain your strength and your flexibility and to help with pain reduction too. So what I'd like to do next is go over common symptoms in acromegaly. We'll discuss those, and then we will hopefully spend the majority of the time discussing treatment approaches for each of these issues, these health issues. So one of those is osteoporosis. In things that I read, vertebral fractures occur 3 to 8 times more frequently in people diagnosed with acromegaly compared to with peers. As Dr. Maloney was discussing, vertebral fractures occur due to high bone turnover due to those imbalances in osteoblastic activity. There is conflicting information. So initially I read that there is deterioration of cortical and trabecular bone. The cortical is the more dense bone surrounding on the outside of the bone, and that trabecular is the more spongy interlattice work kind of bone inside. And some of the stuff I read said that the cortical bone is more dense and is not showing deficits in bone density, but the growth hormone must affect the trabecular bone. So that's just kind of, I think there are ongoing studies to look at this phenomenon. So. Big symptom experienced by most people with acromegaly is joint pain. Common symptom affects 75% of people. Most affected joints are hands, hips, knees, feet, and I didn't add shoulders. Total joint replacement surgery is more frequent and occurs at a younger age. In addition, we all have our normal anatomical alignment that we come with. And some people, as you may have noticed, have knock knees or that angulation inward, and some people have bow legs. So depending on your alignment, that can accelerate the process of arthritis in different compartments. So the way we are designed can accelerate arthritic changes as well. And so as we know, osteoarthritis is a symptom that negatively affects our quality of life. The excess of growth hormone and IGF-1 induces cartilage hypertrophy and osteophyte formation. So osteophytes are bone spurs. So initially, this excess soft tissue can increase the joint space. And then in addition, the ligamentous support around the joint, like those ligaments, because of the growth, excess growth, elongate. And so they are now not supporting that joint. You don't have a really good firm ligamentous support. So then over time, what happens is you get development of more spurring, you have excess mobility in the joint, you get wear and tear, you get bone cysts, and then this will eventually decrease the joint space. So initially it's in a higher joint space, and then it gets compressed to a small joint space and narrowing. Headaches are another common symptom. Primary headache is due to alteration in the pituitary hormones, and Dr. Knievel is speaking tomorrow morning to you, and I'm sure she will be covering the primary headaches. Physical therapy can help with headaches from secondary causes. So there's types of headaches called cervicogenic headaches. Those are headaches that are due to disc irritation, maybe nerve irritation, and then postural dysfunction is a big cause of provoking headaches. There's a syndrome called the upper cross syndrome. There's a syndrome in the lower body, but I will talk about the one in the upper body. It's called upper cross syndrome, and it's where you have poor posture, forward-leaning posture. Your scapular muscles your scapula are riding forward, and so you have elongated posterior muscles, and then you have tight, shortened muscles in the front of your body. So the goal of treatment is to try to focus on strengthening those elongated, weak muscles and to stretch and increase the mobility of those soft tissue structures in the front of your body. Carpal tunnel syndrome is another common diagnosis. And the carpal tunnel is a little passageway from your wrist into your hand, and carpal tunnel houses 9 different tendons as well as the median nerve. The tendons are surrounded by little synovial sheaths, and the sheaths with the synovial fluid around them allow the tendons to glide and move. However, when you are getting the growth hormone causes increased swelling of the soft tissues, and the median nerve also enlarges and it can get compressed. The median nerve provides sensation to the thumb, index, middle, and part of the ring finger. So some of the initial symptoms will include hand pain, hand numbness. A lot of people will sleep in a fetal position where they're flexing their wrists, and that closes down the canal more. So you might notice the numbness at night specifically. And then one of the late symptoms is hand weakness, and that is indicating that the nerves are quite, they're compromised to a certain degree. So, but it's a late symptom. So early cardiovascular disease, so subclinical cardiomyopathy, which is harder to diagnose as symptoms are often not present until the disease has progressed. It causes increased workload on the heart, eventually leading to heart failure. Left ventricular hypertrophy, defined as increased muscle mass in the left ventricle, which is the part of the heart that pumps blood to the whole body. The heart requires more oxygen to keep up with the demand of the muscle, eventually leading to heart failure. And then arterial hypertension, which is increased blood pressure, It also increases a person's risk for developing many cardiovascular diseases such as coronary artery disease and increased risk for heart attack. And then if we talk about the psychological issues, because of body image changes and changes in physical appearance, there's a higher incidence of depression and low self-esteem. And when you don't have energy levels and you're hurting, you don't want to go out. And so there's social withdrawal accompanied by this. And then they've covered in detail in prior lectures, higher rates of diabetes and sleep apnea. I'm going to get to the good news, I promise. So the physical disability model, you have increased pain sensitivity. When your nerves are more irritated and they're just more highly sensitive to pain more than they should be, because you are in pain and you're tired, pain fatigues you. And so you don't have a lot of energy and you have exercise intolerance. Sarcopenia is, the definition is age-related involuntary loss of skeletal muscle mass and strength beginning as early as the 4th decade of life. In people who are overweight or inactive, this process is accelerated. And so I've seen on different websites, therapists are advertising that they treat sarcopenia. And so their efforts are to strengthen you, get your dynamic strength and balance up to help with this issue. Because if you have weak muscles, then you're going to not move as well, and then you're going to have loss of quality of life. And also in the physical disability model, you have depression and cognitive dysfunction and poor sleep. So as you can see, the clinical burdens due to acromegaly are may adversely affect the quality of life. So as I was preparing for this talk, I came across this forum that was presented by the community, the acromegaly community, and it was entitled Voice of the Patient Living with Acromegaly. This meeting date was January 21st, 2021. So I'd like to read these because it really shocked me. I mean, I knew that there's a lot of pain involved, but this kind of brings it home, like what people are dealing with on a regular basis. In my back, I have multiple crushed, compressed, and bulging discs, and this makes things such as sitting, laying down, and standing painful. Even the most basic activities can cause intense pain, such as walking, sitting, laying down, bending over, and lifting light items. I also have a hard time sleeping and end up waking in pain. I toss and turn all night while trying to shift my pain from one side to the other. Another patient, no matter how well I eat or how much I exercise, the weight is so easily gained and extremely hard to lose. It is embarrassing and it has caused a major hit to my mental health. The caller also described persistent weight gain. Even though I work out 6 days a week and eat healthfully, it's like I have no control. So just as you need to try several different maybe psychotherapists or cognitive therapists, you need to find someone that you can relate to, right? Well, the same thing goes for finding a physical therapist. You want to make sure you choose someone that has time. A lot of these private clinics have 4 patients an hour, and really they don't have time to listen or, hear you out. So I would say that it is important to find a physical therapy clinician who actively listens to you and your family, not only hearing what you say, but also understanding your emotions and unsaid concerns. Compassion is central to effective clinical care. So metabolic syndrome is just when you have high blood pressure, impaired fasting glucose, high triglyceride levels, and this all increases your risk of developing diabetes, heart disease, and stroke. So let's now move on to the physical activity model. When you are able to move and when you're progressing toward fitness, you achieve improved cardiometabolic health. So your heart is pumping more efficiently. It's getting oxygen to the tissues. It's helping you with your energy levels. Exercise also increases muscle mass, and Studies show that if you have increased muscle volume, you burn calories more effectively. If you have increased strength, you're moving better. You're able to get out of bed. You're able to get off the floor more effectively. Aerobic fitness, when your heart is elevated for a longer duration of time, the heart is a muscle just like any other muscle, and it needs to be worked out. When you become aerobically fit, you have higher energy levels. You're able to do more. You don't tire so easily. Probably because you can be more active and engaged in life, you have improved mental and cognitive health, improved physical function, improved pain tolerance, and healthy sleep. So let's now discuss physical therapy intervention. With osteoporosis, I need to find my note here just a second. So there was a German anatomist named Julius Wolff, and he came up with a concept called Wolff's Law, and basically that states that bone will specifically adapt to the loads under which it is placed. So it's very important for bone development to have a weight-bearing factor. They have studies from the astronauts in space who, when they got back from extended trips, their bone mass was just depleted. And so we need this weight-bearing stimulus for bone to develop. One of the ways we can do that is just a simple single leg standing exercise. And if you can tolerate weight bearing through the joint and just single leg stand and work up to 30 seconds and maybe do 3 reps at 1 minute would be a great way to just initiate some of that weight bearing stress. Dynamic weight bearing exercise with low force is also very helpful. Getting on a walking program and Tai Chi. We'll be talking about Tai Chi at the end of the lecture. Dynamic weight bearing exercise with high force if you can tolerate higher impact loading. So jogging, jumping, running, dancing, and vibration platforms. I really haven't worked with vibration platforms before, but it's kind of a new thing it's creating a stimulus to the joints through the chain. Also, non-weight bearing exercise is helpful too. They have studies that show that where the muscle attaches to the bone, there's an increased bone density in that attachment site. So where the bone is stressed, so according to Wolff's Law, you get that increased bone density. They did a study on tennis players, and they found higher bone densities in the dominant arm of tennis players. So we know that muscle contractions and muscle active use of extremities can also facilitate bone density increases. Non-weight bearing exercises, including progressive resisted strength training, and a combination of exercise types with more than one of the above exercise interventions is also helpful. So if we talk about jaw and TMJ pain, because of mandibular overgrowth, and this leads to a forward movement of the mandibular alignment, and you can get protrusion. And this may cause changes in the movement of the TMJ joint, the jaw joint here. And because of the changes in alignment, and maybe stress levels, you actually get tension and spasm in like the temporalis muscle, which is the muscles here in the forehead, or in the masseter muscle, which is the jaw, the muscles that work our jaw. And so we have a therapist who is a TMJ specialist in our facility, and she does all sorts of education regarding relaxation techniques, trying to decrease clenching. Postural correction is huge because if your head is really forward, it's further emphasizing that jaw position. She will even go in, like she puts on a glove and goes in and just does trigger point work right on that masseter muscle to just release those and it's super painful. But afterwards, it's very helpful for these patients that have jaw pain. Now, I know that it's not like a cure-all. There are like so many changes with soft tissues and the tongue, it gets so enlarged, but some of these other issues may be helped with manual technique and direct treatment. So we talked about earlier cervicogenic headaches. So these are the headaches which are resulting from neck arthritis. So we do a lot of manual therapy focusing on trigger points. When you've had chronic pain and changes in alignment, you get multiple trigger points. A trigger point is identified as a hyper-irritable point in the muscle, which when you press on it, it refers pain in certain patterns. So we work on releasing these trigger points and then following up with stretching and postural strengthening or lower extremity strengthening for that matter, depending on the area of the trigger points. And then a lot of times manual traction will help. We basically kind of stretch the suboccipitals. We do unloading through stretching and tractioning. There are also studies that show that increasing the strength and endurance of the deep neck flexors can help with tension headaches. There's studies that are showing this is a consistent result. So those deep flexors exercises are just like really isolating the head movement so that it's kind of like the core of your neck. You know, we work on core stabilization. When we work on those deep neck flexors, it's the core of our neck, those really deep muscles that are stabilizers. And then, of course, education on stretching and posture correction. So if we talk about osteoarthritis and joint pain, a common little saying for us is motion is lotion. So that when we move the joint, that's how our joint gets nutrition. So it's very important to work those joints in pain-free in the ranges that you can tolerate. Flexibility and stretching is really important. Sometimes we get if it hurts to fully extend your knee, then you start walking with your knee slightly bent. When you do that, your kneecap, there's more loading in the front of your knee and you start getting patellofemoral pain. And then you start getting weak in those end ranges of extension. So it's kind of like this vicious cycle. So we like to do some passive stretching to get that joint moving into end range, doing some joint mobilization, trying to get the joint mechanics to be facilitated. And then a lot of stretching and on top of that, strengthening. So these are different kinds of exercises that we can prescribe. Isometrics are really good initially when you're having a lot of pain because you're tightening the muscle, but you're not getting a lot of net movement in the joint, no shearing or overwork to the joint surface if you're having a lot of pain. So isometrics, which are just tightening up the muscle and holding it and just getting those muscles to contract, is helpful. A lot of time, aquatics are not weight-bearing, of course, but a lot of times it just feels so good to get in the water. There's nice, warm water to help you move easier. The water's buoyant, and so aquatics is a really nice way to get moving and get stronger. Balance retraining is very important too for fall reduction risk and for just dynamic strengthening. When you single leg stand, you're getting dynamic activation of your hip musculature. A lot of good benefits with strengthening and fall prevention. And then, of course, low impact aerobic conditioning provides so many psychological benefits because you're producing endorphins, which are those feel-good chemicals the brain produces, and it just helps increase our energy levels. So as we talked about before, education is paramount when you're having physical therapy. We treat a lot of the hospital employees. We've got a huge hospital, and when people, they're on their computers all day long and they get in static alignments and forward bad postures, and sometimes they might be in a cramped office where their screen is over here and they get all sorts of pain symptoms. So we have a ergonomic specialist that goes out to their office and she does recommendations for their work site. So she might recommend a footrest. She looks at the chair, makes sure that everything's aligned in the proper angles, make sure that you can see your screen properly. Sometimes she'll recommend equipment like a wider mouse so that you're not gripping so much, or a different chair. She'll change up the alignment of your workstation so that you're avoiding static positionings and incorrect postures. Physical therapists also recommend appropriate assistive devices. A lot of times people come into me, they're very against using a walker. They're like, no way, I'm not going to use that. And so I try to educate them that they might be a high risk for fall. And if they fall and they fracture a hip, that could be a lot worse than going out in the public with a walker. Canes may be appropriate. A cane can reduce the ground reaction force, especially like on the opposite hip, because you're overcompensating with the stronger side, and it gets overworked and can get painful as well. They have a lot of bracing. Stuff I read was that the unloading braces have shown only marginal benefits in terms of pain reduction and improved function. So the articular joint, so an articular joint is a joint, well, it's the smooth undersurface of the cartilage at the end of the bone. Like the knee is an articular joint. The cartilage is that kind of smooth surface appearing cartilage at the end of the bones. And it is an avascular structure, so it does not have a blood supply. So the way it gets its nutrition is through the synovial fluid. And so intermittent loading is very important to get nutrition to the joint. So when you stand and weight bear, the synovial fluid releases its nutrients, and when you unload, it delivers those nutrients into the joint surface. So cartilage is avascular and needs fluid flow via movement. So we just talked about that. And also lack of weight bearing decreases bone density. So benefits of aerobic activity are specifically to the cardiovascular disease. It can reduce your risk for coronary heart disease. It lowers blood pressure, raises the good cholesterols, the high density lipoproteins, assists with weight control, assists the body in managing blood sugar and insulin levels, and decreases level of C-reactive protein, which is a sign of inflammation and an increased risk of heart disease. The psychological issue benefits with exercise are profound. As we talked about earlier, it facilitates the release of endorphins to assist with depression. Sometimes as you meet like-minded people who have similar problems, if you can join an exercise class, it helps with your social isolation and you get friendships and community. Enhanced weight control and improved postural alignment can help improve body image issues. Benefits of weight loss are if you lose 10%, a 10% weight loss can improve function by 30%. A 1 pound weight loss unloads 4 pounds of joint stress in people with knee osteoarthritis, equivalent to 4,800 pounds per mile walked. A few suggestions, and I don't know if it's backed by research, but just improve postural alignment. If you're holding yourself in a more neutral position, there's improved air exchange in your lungs and with the outside air. Education regarding sleep hygiene. So there are things that you can use like a cervical pillow. Just finding the right fit is important because if it's too high, it's going to negate any benefit. Education regarding positioning at night. So, trying to avoid flexion of your wrists. Sometimes we advise using maybe a brace so that you're not able to flex those wrists so it doesn't aggravate the carpal tunnel. A body pillow is often helpful. You can kind of hug and keep that arm in a more neutral alignment too, so that can help. And if possible, weight loss. I know it's really hard when you can't be active to lose weight, but if possible, if you can focus on weight loss. So carpal tunnel syndrome, what we would do, we look at ergonomics. So we try to look at things like if you're doing repeated motions, that can flare up swelling in that carpal tunnel. Joint protection principles, if you need to use larger joints to get the job done. So trying to avoid carrying a heavy grocery bag and gripping. If you're opening things, maybe try to open like the refrigerator door, try to open with both hands and avoid a lot of repetitive gripping. Exercise prescription, we oftentimes start with tendon glides because you get a little bit of adhesions in those 9 tendons that go through that tunnel. We do particular finger motions and it allows those tendons to glide and kind of move more effectively. We work on soft tissue. A lot of times you'll have a lot of trigger points in your forearm muscles or in the elbow. We do stretching. Night splints and bracing are helpful. If you have a lot of swelling, maybe some compression gloves. Contrast baths help with swelling and edema because they help exercise, they promote vasoconstriction and vasodilation of the vessels, and so you get better movement of the fluid. And then electrical stimulation for pain and swelling, and then functional training movement. So a lot of times you might be weak or you have postural compensation. So we work on scapular strengthening. We work on the right way to lift to limit excessive stress on your wrist and forearm. So as we talked about, there's a higher incidence of total joint replacement. So when we have a patient that comes after total joint replacement, we specifically follow each surgeon's protocol regarding weight bearing and progression and range of motion restrictions. Therapy will always include gait training. So we try to teach you the right ways to get up, how to use your assistive device, maybe how to go up and down a curb, or if you have to negotiate stairs, we teach you that. Work on progressing your range of motion safely within those specific guidelines that the doctor has provided us with. We do, once the incisions have healed, and I'm speaking most commonly about the knee, that incision will scar down and it gets tight. So we do a lot of soft tissue techniques to loosen up that surgical scar and get it moving to facilitate your joint moving. And then, of course, we always will implement and progress a strengthening and range of motion program for home. So aquatics, water-based therapies, research showing moderate to short-term benefits for function, quality of life, and pain relief. Land-based therapies show short-term pain relief sustained for 2 to 6 months if you are doing it regularly. Benefits of aquatics are relaxing muscles. The aquatic wellness pools have warm water, which can loosen and relax muscles, allowing patients to stretch out areas that may be too painful to move on land. Improve circulation. Warm water can encourage blood circulation throughout the body, nourishing the muscles and promoting healing. Reducing pressure on joints. Water creates buoyancy, which supports the limbs and reduces the overall pressure on the joints. You can also create resistance by moving faster through the water, or they have paddles and all sorts of devices and weights that you can use in the water to increase intensity. So Tai Chi is an ancient martial art. It's termed meditation in motion. Research shows this ancient mind-body practice can not only help ease your arthritis pain and increase your joint flexibility, but also significantly improve your physical and mental health. I did have it downloaded to play, but it doesn't look like it's going to let me. No. Sorry, it was a cool video. It is, if you wanted to, I've got it listed on my references, so if you wanted to access them. So in conclusion, research, exercise prescription, public health guidelines now suggest exercise can be spread throughout the day in multiple short bouts with similar benefits. 2015 Cochrane review evaluating 54 studies found moderate to high evidence that low to moderate impact exercise improved pain, physical function, and quality of life. Resistance training is the most effective treatment regimen for pain relief in the older population with knee osteoarthritis. In aquatics, people who completed an aquatic exercise program had a 13% absolute improvement as compared to those who did not receive aquatic exercise. So another picture of the Grand Canyon to meditate on. And thank you for listening.
Jill has questions.
So patients often approach me worried about the way that exercise raises growth hormone. This might be a question for Kevin. for Dr. Yoon. But I have tried to tell them that the benefits of exercise typically outweighs, any temporary raise. Is that what you would say also, Dr. Yoon?
Yeah, I mean, the exercise, obviously the benefits far outweigh the negatives. And in fact, it's hardly any, I mean, of course you can get some injuries along the way, but if you're careful, it should be okay. The growth hormone effect is not really very significant in terms of the effect exercise has on growth hormone secretion.
Any other questions?
Okay.
Go first.
Quick question. I think the slide was carpal tunnel. You mentioned contrast bath. Can you elaborate what that is?
Yeah, so you get a change in temperature, like a cool basin of water. There are certain parameters on temperatures. I don't have those for you, but, and then a warm bath. And then you would spend like maybe 2 minutes in one, just bathing the hand and where you're swollen, and then you switch off. So you're getting a change in the temperature, and your vessels, your arteries are compensating and changing according to the temperature. So they're kind of, it's educating them to relax, to open up and close down. And it's just, when they do that, you get better fluid circulation getting out of the area to help with swelling.
Great, makes sense. Last question is, I mean, the whole ergonomic analysis sounds great, but what's like a more economical way we could do that without like having to pay for like a analysis essentially?
I would just say, you can get online and read, but making sure that your computer is straight ahead of you and that you're not having to look up or down too much. You kind of are eyeing on a level basis. Your elbow should be about 90 degrees. Maybe if you have some forearm rests, hopefully that's good. Your hands on the keyboard should not be hyperextended, kind of being more in a level position. If you're using the mouse, you shouldn't have to reach out like this. Your elbow needs to be right by your side to control the mouse so that you're not protracting your scapula and getting neck irritation. So some basics like that.
So I was told that I have severe degeneration in my shoulders, and my shoulders are painful all the time. Now, I keep thinking physical therapy is just going to make it worse. I mean, is it something I should check into, or to me, doing therapy on something that's
Yeah, I think so, because if you do have postural compensations, that places your humeral head in an incorrect spot. And then if you do lifting, you're just further
Right.
irritating it. So if we can give you guidance on body mechanics, posture correction, and start out the range of motion very slowly and carefully. Usually we start with passive range of motion. And then some strengthening is really helpful. Working those scapular stabilizers, the rhomboids, to keep your scapula retracted back. And that scapular stability helps support to take stress off your glenohumeral joint.
okay?
So it can help, and it takes a while to notice changes, but we certainly wouldn't continue on if it was super painful for you.
Right. Okay.
Hi, thanks for that. It was really interesting. This echo is so
Thanks.
strange. I worked with a personal trainer for a couple of years, and it greatly helped with muscle gain, weight loss, sleep. And I think the point I wanted to make was, if it's really important to you, try and find the funds to work with someone like a personal trainer or someone that can support you on a daily basis or a weekly basis to maybe give you an exercise regime, a food or diet plan, something like that, because it is really valuable to our day-to-day living. And we'll invest it in lots of other things, but we won't always see the value of investing in our health.
Yes, I agree.
The second point I would make is, I think a really easy cardio workout is a rebounder or a trampoline. You can get the small ones that you get at home. And I've read that 10 to 15 minutes on a rebounder is the equivalent of running for 40 minutes. So it's low impact on your joints. You will get a sweat on. You'll also enjoy it. And I think if you don't enjoy it, there's really no point in doing it because you're just putting yourself through some horrible pain. And you've got to try and have a fun element to it. And the rebounder or the trampoline works really, really well. So if anyone is interested in really trying to do something at home, look into rebounders.
And that can also help with balance too, because you've got this uneven surface that you're having to negotiate. So yeah, that's a great suggestion.
Yeah, do you have a relationship in your field with chiropractic care?
We kind of have different philosophies, but I certainly have seen people benefit from that. I would be sort of reticent to recommend someone that had cervical arthritis going to get manipulated. I just feel like it's very dangerous, but they could maybe explain why they do that. But I mean, those sports chiropractors have helped, like in the lumbar spine, where you have big joints, big vertebrae, I feel like it's much safer. And if it just, I think maybe not getting over manipulated to where you become more hypermobile. You know, you don't want to, we're trying to get strong in our muscles to support joints, and we don't want to get excess movement in joints that are already irritated.
So do you have any information on your website about home type activities for seniors and stuff for activity and exercise?
Unfortunately, no. That's a great idea to think about doing, but we don't.
Thank you. There's a question back here.
So I was curious, you said that carpal tunnel is, you're kind of at a higher risk for carpal tunnel with the acro. What about cubital tunnel or tarsal tunnel? Do you see that a lot? And are there also exercises and things that you can do to help with those?
Yeah, it's the same principle. You know, you've got a nerve and tendons running through a small space. So those are more rare diagnoses. So don't see that so much, but certainly we could try to treat it if we were referred out for that.
A question down here.
Now you've mentioned a couple of times hypermobility or joint laxity. At least from personal experience and some anecdotal experience in the group, some of the hormonal imbalances that you find in populations with acromegaly, we have an increased issue with joint laxity and hypermobility. Do you have any recommendations in that context for doing things safely with a PT program?
Yeah, I mentioned, I wrote down on my side notes, but yeah, hyperligamentous issues are really an issue, not just with acromegaly. I see it all the time, and a lot of times, you know, gymnasts, former gymnasts, they have hardly any stability because their joints have just been stretched to end point. And so it's important to, like with lumbar instability, you know, you have issues where you get more instability with forward slippage of the vertebrae. So we always will put people on core stability programs. We look at positional ways to exercise. So someone with a lot of laxity or instability in their shoulder, we're going to teach them, do not kind of move into these end ranges where you can dislocate. Your SI joint can get hypermobile, and you can get asymmetries and lots of pain and problems with weight bearing because of the SI joint being hypermobile. It's a real common problem that people are having. So I think just strengthening within shortened ranges, teaching them to avoid end range, unsafe positions, and postural alignment, kind of strengthening in that neutral position is helpful. These are great questions.
Is it done? So question from online is, what is the benefit and process when working with a physical therapist in gait training?
Okay, so like postoperatively, some people might be non-weight bearing, and so we get them used to contracting their muscle in kind of a non-weight bearing way, and then with using their walker, we add loading as the surgeon will allow us to. In someone who maybe has hip osteoarthritis and they've got like we call it a Trendelenburg gait pattern where they're getting a lot of shifting. So we work on a lot of strengthening of the hip abductors because those are the muscles that are really weak and causing that significant compensation. So depending on what we're seeing in the gait and what area might be causing it is how we approach. And we work in, like having them take small steps first, and then we'll work on uneven surfaces. And it's kind of a whole process, but it's all variable based on the issue at hand, kind of what we're trying to treat. Someone might have a foot drop due to nerve injury, and so we make sure if it's really pronounced, we might need to get them braced in an AFO before, so that they can clear the ground and they're not catching their foot and increasing their risk for a fall. So it's variable depending on kind of the issue, the pathology that we're finding.
Last question.
I have a simple one. I was just wondering if it's a general practice that a physical therapist can only work on one area at a time, perhaps by insurance requirements or something?
Yeah, well, I guess each different place has its regulations. In private practice, I'm sure it would be fine. They can treat you for anything. Here, we have to, if it's the same referring physician, we can add in a diagnosis. Like I have a patient that has back pain and now she has knee issues. Same referring physician, so I can just add it onto her treatment plan. But if it's a different referring physician, we have to do a whole other evaluation, and it has to be a separate treatment time. So, that's kind of how that would work.
Thank you.
Thank you.
Thank you, Janice.